President Trump last week gave a very much anticipated speech about his strategy on this matter to lower drug prices for consumers and for the system. What were your initial responses?
I think our initial response was it's a step in the right direction. The challenge we all have is we're on the verge of miracle drugs. And the problem we all have is that those miracle drugs are going to have a miracle price, and how do you figure out how to pay for them? And I think what we saw this past week was a step in the right direction. But we really have to think about the whole healthcare system differently. When I think about the 5 million people that we serve, 22% of the money that employers and individuals are spending on their healthcare is going to pharma. And that's not necessarily sustainable. So what we have to do is to think about things differently. Highmark Health just partnered with a drug called Symbicort, which for the first time will pay for the drug, but it's all at risk, meaning they have to get the outcome that they promised in the TV ad and to the patient. And if we get that, then they should get the benefit of that, and they should deserve payment for that. So we think that's part of the model that has to happen. Again, we've got to move away from volume to value. So when people make decisions to invest in healthcare, there's got to be returns on that investment that lead to better outcomes.
How do those kinds of outcomes-based payments trickle back to the consumer at the pharmacy counter?
Well, I think there's a number of different ways that can happen. I think you can do that through, obviously, most people when they're in a medical concern or have a medical condition, number one thing they're concerned about is getting better. And we can never forget that. And that's why our whole strategy is patient-centered, clinician-led as we think about how we're transforming. But then what happens is they start to be concerned about the economics. And so there's a lot of different ways that you can transfer the benefit to the patient through your insurance rates, through co-pays and deductibles, and how you design products. And so the one thing I would just suggest you have to remember, though, is you can't disassociate pharma from the medical side of it. One of our biggest challenges today in America is unfragmented care. So what's happening is one physician may see somebody for a cardiac concern. They prescribe a prescription, and then somebody else sees them for a pulmonary concern, and they give them a prescription. And so that fragmentation leads to conflicts, and it leads to inefficiencies as well as poor outcomes.